Welcome back, my friends, to the D-Rate the Hate podcast. I am your host, Wilk Wilkinson, your blue-collar sage, calming outrage and helping to navigate a world divided by fog and those who would spread that fear, outrage, and grievance. Each week, I'm sharing stories from my path and using the power of conversation and collaboration with my many great guests. Together, we chart a course toward understanding, bridging divides, and fostering a community where wisdom prevails over discord. Friends, it really is about bettering the world one attitude at a time. We did not create the hate, but together we can derate the hate. The only good thing about a bad attitude is we have the ability as individuals to change it. For me, it starts with gratitude and personal accountability. I am so incredibly grateful that you have taken the time to join me for another powerful DTH episode. Please remember to subscribe and share the DTH podcast with your network of friends. If you would like to support the show, check out the Support Us page on the D-Rate the Hate website. With that, my friends, let's get to it. Today, I am joined by another truly impactful guest, Dr. Nikki Johnson. Dr. Nikki is not only a physician with years of experience in pediatric critical care, but she's also become a fierce advocate for patients navigating the modern healthcare system. Born and raised in East Cleveland, Dr. Nikki has seen firsthand how the doctor-patient relationship is often overshadowed by corporate healthcare interests and insurance demands. We're diving deep today into some of the major challenges that she's witnessed, like how insurance companies and government policies are increasingly influencing which treatments patients receive. Dr. Nikki argues that these outside forces are eroding the core of patient care, where the focus should be on the personal bond between a doctor and a patient. As the interim director of Fair in Medicine, she's leading efforts to educate and empower patients so they can take back control of their healthcare choices. We'll be talking about her involvement with grassroots organizations like Free to Care and what it means for physicians and patients to unite against a system that can feel impersonal and at times restrictive. Through her work, Dr. Nikki is helping more people understand their rights and advocate for the quality, transparency, and choice that everyone deserves in their healthcare. So whether you felt frustrated by healthcare decisions being made without you, or just want to know more about reclaiming your power in medical care, stick around, my friends. This conversation with Dr. Nikki Johnson will leave you inspired and informed on what's possible when we demand better from our system. Hey friends, it's Wilk, and before we get into this week's incredible episode, I would like to tell you about another podcast that you might like from our friends at Braver Angels. A Braver Way with Monica Guzman is a podcast that's about politics, but it's so completely different from any politics show that you've heard. Each episode leaves you with a better understanding of your fellow Americans, even ones who, when you hear about them on the news, totally confound you. Their goal for the current season, which I absolutely love, is to help you face this election year without losing heart. You can find it at braverangels.org/abraverway or by searching A Braver Way wherever you get your podcasts. Friends, I absolutely love this show, and I hope you'll give it a listen. And with that, let's get to this week's episode. Here we go. Dr. Nikki Johnson, thank you so much for joining me here on the D-Rate the Hate podcast. I'm so excited to see you again today.
Thanks for having me, Wilk. I'm glad to be here and get to talk about things that I've been doing and just have a great conversation with you.
Absolutely, Nikki. First of all, I want to start off by saying how grateful I am to our friend Monica Harris, Executive Director of the Foundation Against Intolerance and Racism. She is the one that reached out to me and said, hey, I've got this gal, Dr. Nikki Johnson. She's the interim director of Fair in Medicine for us right now. You two, being the great people that you are, have to get to know each other. And then we had a conversation a little while back. It was wonderful, Nikki, and so excited and so grateful to Monica for introducing us, and then so grateful that you have decided to join me here on the D-Rate the Hate podcast. So getting right into it, I want to. In introducing you to the DTH listeners and trying to figure out more about, what FAIR in medicine is, obviously a spinoff of FAIR, the Foundation Against Intolerance and Racism. I want to start off, Nikki, by looking at your website and the mission that you have personally really stood out to me as something so important, as somebody who's done a lot of work with trying to rebuild trust between we the people and the public health establishment, and then having heard some about your story. So I want to start off by reading this statement on your website, and that says, I am a physician by training, a healer, and an advocate by design. For too long, healthcare has been in the hands of everyone outside of the exam room, but health and healing belong in the hands of the patients and their doctors and nurses. I seek to educate, empower you to reclaim health for yourself, your family, and your patients. I want to inspire you to prevent disease, maintain health, be informed about your choices, and advocate for policies that benefit you. Nikki, start off by telling the DTH listeners, what does that mean to you? Where did that come from?
Oh gosh, where it came from was more than 20 years of experience practicing clinical medicine and learning how the medical world works, how healthcare works. Probably in about 2016, 2017, I started being active on social media. Prior to that, I was in the dirt of, doing the work of learning and training how to be a physician, and then actually working, doing all the late nights and all of that. But I never learned how the sausage was made. And I started connecting with people who were complaining about some of the same things. In Facebook groups is where it really, originally started. Reddit, maybe a little Reddit, and some other kind of communities as well. And it was like having the doctor's lounge on the internet. And so I could talk to people across the country about things that were going on. And the things that we were frustrated with were, we were seeing, of course, first we were frustrated with being blamed for the cost of healthcare in the first place. When we realized, though, that the majority of us had become employees of large health systems, we realized, we really didn't have control over the prices in healthcare. And so that was one of the factors. And then it was, we started seeing how we were, hospital systems and were buying up large, small medical practices, and becoming a lot more dominant. And so you weren't seeing these, your local family doctor in their, house turned into a clinic or office anymore. You weren't seeing those neighborhood clinics. And that was actually something that I thought that I might end up doing when I got into medicine in the first place, was, a doctor who, takes care of my community. I ended up, going down a route of intensive care just because it worked out, obviously better for me. And I felt like that was where I fit. But even still led me to notice what was actually happening. And then we started seeing how things were controlled. Like, so I'm in a clinic, or my colleague's in the clinic, or I'm even as a patient, go see a doctor, and my doctor prescribes something to me. And then, or I order a medication for a patient, and then that medication gets denied by an insurance company. And it was different for every single insurance company. And we were trying to figure out, well, how the heck does this happen? So if I'm having this conversation with my patient or my doctor, we determine together what's the best for me. And then somebody else who doesn't even see the patient, has no interaction,
Right.
sometimes not even have any medical background whatsoever. And often, and if they do, it's not in the specialty that I'm in. They're the ones who get to decide whether or not this medication or, even imaging scan or lab test or whatever is an appropriate thing for their patient. So
Sure.
that led me down this rabbit hole of kind of trying to follow the money and find out what's the solution. I'm generally not a complaining person. I like to do. I'm a doer. That's what I do. I like to help people and heal people. That's how I ended up
Go
in
to the
medicine.
root cause of the
You
problem and
cannot
figure out a
go
way to fix it.
through a training process in medical school and training with the level of rigor that it requires, the level of sacrifice that it requires, the level of debt that it requires, without having some real commitment to actually wanting, to help and heal people, right?
Sure.
And so, and then the other piece of it was I'm starting to see, which is one of the reasons that I didn't go into a clinical, like family practice or, regular, adult medicine or general pediatrics clinic, seeing patients every day, is because during my training, I realized that the time period that I had to actually see patients and solve problems or prevent illness was decreasing all the time. And that time limit was set by somebody else who wasn't actually seeing the patient. And I just felt like it had grown out of the control of the people who were really the primary stakeholders. And so,
the people that should be making the decisions were no longer making the decisions. And so let me ask you, I want to dive into that just a touch before we kind of move on, because I'm hearing that I guess a common theme of what I'm hearing from you so far is a lot of the decisions that affect our healthcare were no longer, obviously no longer between that doctor-patient relationship. That doctor-patient relationship is now being fractured or interrupted by outside forces, and you're basically just a go-between now between some other entity and the patient, instead of being the primary advocate for the patient, which is what I and so many other people have always believed that the doctor was supposed to be. Was the advocate for the patient, but you're not actually getting to advocate for the patient.
No. And you don't, and for the most part, you don't really know what things are costing people. You just don't know. So, you've got the insurance, so this third party in between. And I don't even like to use the word insurance, because really it's just it's a payment plan type system is what it is. It's not insuring anything.
Right.
Because if it were insuring something, it would insure your health in the first place, because, the goal is to get you healthy. And I wasn't really seeing that happen. But yeah, it completely took it was taking the decision making away from the patients. Patients were, you get on this panel from, whatever your health plan is. You have a list of people that you can see that are on the panel. Though that became what's called the provider list. Then you have a list of medications that they cover. You have a list of places that you can go to get your care. And so all of these things were just now, for some people, it was great. It was convenient. It makes it easy for me to pick. I don't have to think about these things. I can just select from this list. But when you realize really what's happening is that you're giving up control over your care. And so, and the doctors didn't really have a say. When you were working for an employer, they determine which insurance, that they accept, the type of insurance that they accept. So then, that determines what each patient, what I can do with whatever what with my patients are. So for me in pediatrics, though, it didn't bother me as much. I mean, well, it didn't affect me as much because, one, I was on the inpatient side and in the intensive care. People came to me when they were sick. They didn't really have a choice where they were.
Their needs were pretty much immediate, right?
And they had to get care because it was urgent, or emergent. It had to happen.
Right.
And so worrying about paying for it came later. So it never really affected me. I didn't have to look at somebody's insurance while they were lying there critically ill and say, can I prescribe this medication, for them? I could just, order it and it would come. But on the outpatient side, it was very different. And I was always, I have chronic autoimmune disease, so I know what it's like being on the other end of things. I have parents and family who had chronic illnesses or had experiences in the medical field. So I had experience on both sides of, the exam table. So I knew these things were actually happening and very frustrating. I remember once my mom, may she rest in peace, had a referral to go and see a kidney specialist. Okay. She gets to the specialist and they did not put her with a physician. They put her with a physician assistant, and which is fine for people. I'm not against physician assistants or nurse practitioners, but when you have an older person who's expecting to see a physician,
especially a specialist,
and a person who has chronic disease and complicated health, they want to see the physician. And so my mom, without me even knowing that this happened, she decided, she said that, look, I will talk with you, but I better see the attending physician before I leave here. Right. Because, and then, in that case, that attending is going to bill you anyway. So your bill is not going to be very much different.
Right.
So all of these things were, light bulb, coming out for me. And I was seeing this stuff, and then I was beginning to learn how it worked. And so I connected with other doctors in these social media groups who were sharing these, same concerns. But then, it can only last so long for you to hear people just start complaining before you realize that, there's not many people doing the work. So I asked once in one of the groups, okay, who's actually doing something about this? And then a handful of people reached out to me and said, we're doing this, we're doing that. I got connected with those people and actually started doing the work and, nice. Building our own nonprofit organizations and trying to educate people, but also trying to come up with policy ideas that would lower the healthcare costs for patients and to really get back to that doctor-patient relationship. And that the largest coalition that ended up forming, which I'm very proud of, was called Free to Care.
Free to Care.
The word free on the number 2, and then the word care. It's actually a large organization of multiple grassroots organizations that are not only physicians and independent grassroots physicians, also employed physicians, but also nurses and patient groups. And so that was key. And so all of these groups were doing all of these different pieces of the puzzle. And in 2018, we wrote and published our very first white paper on lowering the cost of healthcare. And we picked people from each of these, grassroots groups who were doing work to write different components about that. And my contribution to that paper was helping with the physician shortage. And during that time when I was writing that piece, I learned that the physician shortage as well as the nursing shortage is pretty much manufactured by government policy. And let's of course, right?
Yeah, hold on. All right, so I just want to slow down here for a second because there's a couple of things that are important here that I really want to talk about. Number one, thanks for being one of those people, Nikki, who instead of just getting online and complaining about things or trying to stir the pot or whatever, thank you for being somebody who's actually looking at the root cause of things, well, looking for the root cause of things, trying to define what the problem is, and then trying to find solutions to the problem. Because far too often, this is one of the things that drives me absolutely crazy. Far too often, there are these people, they're just agitators or outrage entrepreneurs or whatever, that take advantage of a situation. They don't care what the root cause of the problem is, but they love to take and just dive into what the outrage involved with the problem is, and then instigate more outrage.
Yep.
People have become very
Yep.
popular doing that, and I think that's very problematic. I think that's a big part of why we're at with the problems that we're having today,
Yeah.
with the trust between we the people and the public health establishment.
Yeah.
So thank you first of all for
that
being.
can be a lucrative venture too. You take advantage of
It's been
people's
very
anger
lucrative
and
for a lot of
emotion
people.
and frustrations and turn it into a podcast. And not that's what you're doing, but there are people who
Yeah.
are out there doing that and actually,
Oh, there are plenty. There are plenty.
monetizing it. Yeah.
So thank you for being somebody who's actually looking to solve the problems that are affecting our systems. Second, let's get a little bit further into this because the one question that I had for you with regard to the free to care and the paper that you wrote and why healthcare is actually costing so much and I mean I think anybody can look at our healthcare system today and realize that nothing the government has done in recent years has actually reduced the cost of our healthcare or improved the method by which we receive our care. I know that's a controversial thing for certain people, but the reality is if you look at the way our healthcare system is today versus what it was 12, 16 years ago, let's say, there are big differences. And the thing that I think bugs me the most is something that you're tackling the hardest, and that's that doctor-patient relationship and how the doctor has the ability to do what they think is best for the patient based on that patient as an individual. So when you started writing these papers with say whether it be free to care, or I know you've been involved with other organizations like Physicians for Patients and Urgency of Normal, Restore Childhood, these different organizations, when you and your colleagues doing this work started bringing these things to our government officials, those who supposedly represent us, or what kind of response were you getting from them?
So I would definitely say early on, especially around 2015, 2016, when there was, so much buzz about taking down the Affordable Care Act, right? There were a lot of people saying how bad the Affordable Care Act was, but they didn't really have any solutions for the Affordable Care Act, right?
Mm-hmm.
So we got the Republicans to actually listen to us, because as we met with them at different levels, at the state level and at the federal level, when we met with them, we realized they had nothing.
Okay.
Which the rest of the public could easily glean, right?
Sure.
They didn't have an alternative plan, right?
Easy to speak out when you,
yeah, we learned that pretty much right away, but they were willing to listen and to learn, right? But at the same time, as we were giving them our ideas, because we were learning that there was so much involvement between, and so much, such a tight-knit relationship between the government and industry. And these middlemen, these large middlemen called the pharmacy benefit managers and group purchasing organizations, would have nothing to do with the rest of industry. They don't make any products. They don't do any research. They don't take care of any patients. They just kind of in the middle of things. When we learned that these are the people who are controlling all of this together, and they're working together, even our own medical organizations, all working together, and there was this financial arrangement, then we understood how difficult it was going to be to knock this stuff down. And for me, the thing that I take away from this is there's not going to be some overarching piece of legislation that's going to fix this problem.
Right.
And a lot of Americans are actually looking for that. And to me, that's a concern. And I wanted to make sure that was communicated with people. This is going to have to be a piecemeal approach, peeling back layers of things that are not transparent, and kind of rooting out the evil. But it's very uncomfortable hearing it, seeing it, reading it. And it is often very, very disconcerting. It is difficult being in this position because
I can imagine. Yeah.
I can't do anything about it as not being a politician. I can write some legislation or write you some sample legislation, right? And I can present it to you, but I can't go up and tell you to actually get this through, a bill. I can make a dozen phone calls and get my group together, and we can make calls and get legislators to kind of pull up bills and get them out of a committee, or hold a hearing on it in a committee, get it out of committee, vote on it. I can get people to do that, but I cannot get them to bring the bill to the committee in the first place, right?
Right.
And this process takes a really long time. And then we're having to compete with large lobbies. So on top of that, so these organizations who have a great financial interest in the way things are right now they have more people, they have more bodies, they can be on Capitol Hill all the time or down at the State House every single day if they need to be. And they know they have people full time who lobby, and us as physicians, and the majority of us doing this are people who are still practicing it. I'm not practicing at the time that right now, but the majority of us were. And when you're living, you have your own family, you running, you have a busy career, you don't have a lot of time. You can't be at the State House. You can't be on Capitol Hill in DC every single day. To be able to present in large numbers to make that kind of an influence to get these guys to do the work. So you have to build relationships, and it takes some time to do that. But there were definitely a lot of people who were perceptive. We reached out on both sides of the aisle. We didn't leave anybody off the table. Anybody who wanted to listen and solve the problem, we were really, really willing to talk to anybody. And so that, and there were things that we could find on a common ground. And if you read our paper, we never ever get political. We never say we're against Medicare for all. We'll never say we're, we need to go down with the Affordable Care Act. But we're going to point out problems with those things. And then
you should.
And then what we did was look at legislation that was actually already in existence, or propose our own, legislation or at least policy that we wanted to see that could tackle these things. And we did it in the most recent paper. If you go to the website now and see it, it's actually a lot more palatable and a lot easier to read, I think, than the very first one. The first one was a lot more technical and harder to read for people, but you can really see the layers of government and industry influence in there, and in a way that makes it easy for people to understand. And you can take those bits and pieces and go and ask your congressman for those things. And they're
let me stop you there for a second. So when you say go to the website to see these papers and stuff, are we talking about fair in medicine? Or are we talking about free to care?
For free to care from this particular, what we're talking about here. So free to care for that, for the white paper and lowering the cost of healthcare. So that stuff is there, and so that was happening. That was a big part of my growth into, learning how to, advocate for patients and family, myself and other physicians. And, so I was doing that as I was practicing too. And so I was trying to navigate, I was arguing for policies that would hurt the American Hospital Association.
Right.
You know,
So,
that.
so let me jump in here, because that's something that I want to talk about, and is, so as a physician working for, because there's a couple things that you said along the way there that now combine to make for a pretty scary proposition for somebody who is still depending on that job, their career, to for their livelihood, to take care of their family. And you talked about how, like, this corporatism and these big hospitals kind of took over, and you now became basically an employee of a much bigger system, a kind of a small cog in a big wheel kind of thing. And then now you've got these different physicians who are trying to speak up against a system that they are working within. So that's obviously a pretty scary proposition for people to when they realize that it's probably not just their organization, but probably almost all organizations within this system are now kind of in this same boat, because it goes much further than just their particular organization. So if they start to become vocal about a system that is clearly broken, they can probably ostracize. I mean, have them, they can get themselves alienated from the club, right? I mean, they can get kicked out of the club, and now all of a sudden, the profession that I love, the thing that I've gone into because I really have a strong desire to take care of people, I now have no place to practice my trade, practice my craft.
Yeah.
So that's got to be pretty scary.
Yeah. And so, at the time, when I was working, I had, through those few years, I gotten myself promoted, and I was a director of a unit, and I was very, very specialized and subspecialized. And I was great at what I did. So I felt pretty safe in that way, that I wasn't going to go anywhere, but I did always have that concern. And then hospitals started to have, like, social media policies and things like that. And so it really wasn't that work that got me in trouble. When I got in trouble was when it came to speaking out about COVID policies. And then during COVID was when I started working with Urgency of Normal and Restore Childhood, and I was speaking out on behalf of children and the policies that were harming children. And those things really, and then speaking out against masking and public masking, and things that I started to see were against everything that I knew and learned as Hippocratic medicine, which is treating people as individual patients who have individual needs, taking the knowledge that we have and applying it to those individual patients in the way that's going to serve them the best. And so when I noticed that we were treating children worse than we were treating adults for the most part, and we were isolating elderly people from, their families, and sick people from people who loved them while they were in the hospital. For me, that was the point when I started taking, fewer precautions. I actually, at one point I was, in the beginning when I started doing health policy, I actually had two separate accounts. I was on my Facebook page, I was very professional. I didn't say a lot of, my political views at all. I just really focused on the health policy and doing that work. On Twitter, at the time, I had two separate pages. I had an anonymous page where I was doing my just political statements and all of that stuff. I didn't let anybody from work follow me. And then I did the health policy stuff on the side. Different accounts. But when I started when doctors started being a lot more vocal about things that didn't make sense to me, I felt like, well, what the hell? Why am I hiding what I have to say? People really need to know. And at the time, my political Twitter account had a lot more followers than my health policy one, because the health policy stuff isn't as sexy. It really isn't. People.
No.
It's and so I just said, forget it. I'm chucking this one, and then I just stuck with my political one. And so everything was out in the open. Both pages were public, open to the public. And then that's when people from work started actually basically shadowing me without me knowing. Like, there were people who were following me who I didn't know were following me, and then they were reporting my tweets to work.
Okay.
So I ended up having to meet, with the boss and with HR several times about things that I was speaking that was against hospital policy. Although I thought was in line with everything I learned as a physician, to treat people, the right way, informed consent, and good, like, rigorous research and evidence, not having this consensus that people say was, a created consensus. And I think Jay Bhattacharya does agree.
The illusion of consensus.
His version of, the illusion of a consensus was exactly what I was feeling. Like, wait a minute, this stuff is not settled. This is not a consensus. I thought I was going crazy. I thought I was taking the crazy pills. And so when I was seeing that, I just felt like I couldn't not say it anymore.
Right.
And publicly, I was the one asking questions in these Zoom town halls we were having during COVID. Mm-hmm. And I was asking these questions that weren't getting answered out loud. I was asking the questions that nobody else was asking publicly. Mm-hmm. And that's when I started to get, I started getting questions like, do you really want to work here? Kind of those kind of things. And
are you sure that this is the right avenue?
Yes.
For you? Yeah,
I got that a lot. I got that a lot. And then I really just got scrutinized for every little tiny thing. And it made going to work a very, very, very tough place to go and work. And I ended up leaving. And that's how I ended up at, the short version of this is how I ended up at Fair in Medicine. Yeah. They needed somebody to come and take a role that had been filled very well by Dr. Carrie Mendoza, who ended up going to GenSpec to do her work with gender dysphoria. But they were looking for somebody who fit the bill who actually wanted to bring patient care back to, Hippocratic medicine and tell people the truth, all of those things. And so that's, that's where I am now.
Okay. Very good. So, well, thank you for that, Nikki, because there's a lot of things there for people to unpack, and there's so much there, and thank you for the backstory on that. Because I too have spoken to a number of people. Now nobody can ever confuse me for a doctor, but I've got to speak with some of the most well-renowned physicians and scientists on our planet. So I've been lucky in that respect. Yeah. One of the things that always strikes me is I've had conversations with a number of people, both very well known to people, just everyday nurses, everyday doctors, people that are working in rural hospitals and taking care of patients. That the stories there's so many similarities to these stories, and it's heartbreaking for me as just an everyday American citizen out here in the rural Midwest to know that some of our best and brightest, some of the people that have spent their lives learning this craft of taking care of people and now cannot do it the way that they know that it can be done best. Yeah. Our political system, Nikki, has become one, and maybe it's always been one, but I people have heard me say it before. Those who represent us are far too often not the best of us. And and in so many ways they end up being controlled by other interests and whatever. And I think it's very unfortunate. And I think a lot of what has happened, not all of what has happened, but I think a lot of what has happened over the past several years, and not just specific to COVID, as you know, as you've alluded to, this didn't start in January of 2020, but these problems have been brewing for a while.
Yeah.
And we as citizens, the people that are being taken care of by this system, really need to know what's going on. But more than anything, Nikki, I think we need to be sure that people can stand up, speak out in a fearless way, and have that conversation, because I think that's what's not happening.
Yeah.
I don't think that's not what's not happening. I know that's what's not happening. And we've got so much to talk about, and we're at the end of our time for this particular episode. And I know we're going to, I mean, I already know that we're going to do a lot more work together, but so this is just the tip of the iceberg for us, Nikki. But let's talk real quick as we round out our time here, because it's gone way too fast, and it's definitely gonna leave people needing so much more information that they will get. You and I will do a lot more, but talk about what you're doing right now. What is your main focus at Fair in Medicine? And we'll just kind of do a couple minutes on that, and give them the abridged version of what's going on there, so they can find out more.
Abridged version. So just briefly before I tell you that is, I do want to give people hope that, that there is a way that you can advocate for yourself. And the way that you can do that is by equipping yourself with the knowledge. And so anybody listening to this, I'm sure wants to figure out how to help themselves and how to help others.
Absolutely.
You can't listen to a podcast like this and not really have that in mind. So, So what I'm doing at FAIR really is about educating people en masse, is what I'm trying to do. I'm trying to educate not only the public about what's happening, what some of the bad things, exposing the bad things that are happening, unpacking it, making everything kind of transparent so you know what's going on. But I also want to give people tools for ways to navigate in the system that we have now, but also things that you can do for yourself. To help, advocate for your own better health. And, for my own personal goals, I want people to be healthy. And there's so many ways that we can do that without insurance, without a medical, without even a doctor. I mean, just simply going out for a walk. If you're able-bodied and you have legs that move, then you can go out for a walk for exercise. You don't need an expensive gym or membership, anything like that to do that. Picking the right foods, those kinds of things, things that if your body is responding to it in a negative way, it's probably not something you should be eating. Just simple things like that. But at FAIR in Medicine, we want everything. The kind of the building blocks of FAIR for all itself is really trying to build a world where everybody is treated fairly. And so, but on the medical side of things, that needs to extend to patient care and how we treat people. And then that does require, though, having to learn and kind of go back to the original, the origins of what Hippocratic medicine is. Do no harm is actually, little side note, do no harm is not actually a part of the Hippocratic Oath. But when you actually read through the Hippocratic Oath that was, adopted here, that was presented at Geneva, it does all of the things that are described in it. And the phrasing that are described in it is basically a doctor saying, I will do everything I can to acquire all of the knowledge that I can, that with the goal of helping my patient get better, get healthy. And that's the bottom line. And so what I'm doing at FAIR is trying to achieve that bit by bit, with different topics. So we're doing webinars. We're going to, FAIR for All actually has its own Substack, but FAIR in Medicine is going to eventually have their, hopefully very soon, have their own Substack page where you can find out all the information and things that we're doing and connect with us. And we're going to start creating some content that can be used for continuing medical education and continuing education credits for health professionals, because we all need those things to maintain our licensure. So we want to give something to you as in that form too. But it all works. We're all, for the most part, the organization is run by volunteers. So anybody who's interested in helping me out, I do need some volunteers, but at the same time, we also need money, just like everybody else, right? We can't function. I don't make a physician salary anymore. This is my job. So I do, I thrive on donations. So, if people want to pop over to the website in fairforall.org/donate and donate, and you can actually select, where you want your money to go, or, put in the comment. Come and help us out. That'd be awesome. But check out our webinars. Just did one yesterday on the gender medicine topic, and giving parents some tips on how they can navigate through with a child who has, gender dysphoria, and just by parenting, just so. We're trying to be a little bit different and take a broader scope than what some of the other organizations are doing that are now very niched into very specific areas. But we really want to kind of root cause and let everybody know what's happening and how they can help themselves. So.
No, that's absolutely beautiful. I've done so much over the past few years. Spoke with so many people from Foundation Against Intolerance and Racism, the organization, and I'm very excited that FAIR is now going not going into but branching off with FAIR in medicine, and the idea that there's so much work to be done here, Nikki, to help people. That doctor-patient relationship is so incredibly important. And then there are so many things about medicine now that have become politicized, and people need to know what they can do to advocate for themselves and find people that will advocate for them and be knowledgeable about what it is that they need to do to better make decisions. So these things are so important. But the biggest thing that I want to stress here, out of our conversation, one of the biggest things that I've taken away from this is the idea, as with so many things, the idea is there's a lot going on. And if we're not having conversations with people of diverse opinions, we're not going to get the whole story. We're not going to be able to make the right kind of decisions, no matter whether it's COVID policy or if it's gender dysphoria or if it's how our child is being treated in the ICU out there in Ohio or whatever. If we are not getting all the voices heard, if we are not having the conversations, we're not getting things done the way that they need to be done. So people need to have an open mind. They need to find the right resources. They need to talk openly about what they see, what they hear, what they feel, and hopefully at the end of the day, we make the best decision possible to, again, prevent disease, maintain health, and be informed about the choices that we're making. So Nikki Johnson, thank you so much for joining me here on the D-Rate the 8 podcast. It's been incredible, and I look forward to so much more with you. Thank you.
Thanks for having me, Will.
Friends, if there's anything in this episode that provided exceptional value to you, please make sure to hit that share button. Share it with your friends, share it far and wide. And of course, if you haven't done so already, be sure to subscribe right from our website so you can get the D-Rate the 8 podcast sent to your email inbox every week. So this is Wilk wrapping up for the week, saying get out there, be kind to one another, be grateful for everything that you've got, and remember it's up to you to make each and every day the day that you want it to be. If there is something that you would like to share with me, you can catch me on most social media platforms, or you can email me directly, wilk@wilksworld.com. With that, my friends, I am going to back on out of here, and we will catch you next week. Take care.